Hello. Good morning. Good morning. Good morning, everyone. Hope you can hear me. If you can hear me, type in the chat, okay?
Hello.
Good morning. Oh, Princess, sorry, I was muted.
Good morning. How are you?
I'm good.
Awesome.
Welcome.
You look good.
Oh, thank you. Thank you. It's our special day.
Yes.
It is our special day.
Yeah.
So it's 11:05. I think we should start.
You
Others
don't
can...
want to give a few minutes?
we already gave 5 minutes. Okay, maybe 5 more minutes, we'll see.
Yeah.
Thank
Because
you.
it's only 4 people here, just me, you, and 2 others, I guess.
Okay. Thanks for your patience. Some people work with time. I want to start right on time.
When are you having the next one?
We do something every month, so it will be next month, but we'll send out the flyers.
Okay. Please.
But every last Friday is a question and answer time. Every last Friday of the month, we do like a question and answer. If people have any health questions, anything, especially on the topic or for the month, but it can be any question. We do that.
Okay, last Friday of every month.
Last Friday of every month, yeah. And we just changed the timing this starting this month to 11. It used to be in the evening, but we want to accommodate people who may be connecting from outside United States.
Oh, okay.
So it's not like midnight. For instance, Nigeria, you know, our 6 p.m. is their midnight. So we want everybody to sleep and maintain wellness.
Yes. Yeah, please, next time send me on WhatsApp so I can forward to people.
WhatsApp. Okay, we'll do.
Yeah, I was able to send to some people, but I don't know if available.
The
But
notice
whoever is fine.
The notice might be late, but it's okay.
Yeah.
We still share it to people who signed up. So if they sign up, we'll send them the message.
Oh, okay.
The presentation, yeah.
Oh, that's awesome.
Yeah.
That's awesome. Thank you for doing this.
That's fine. That's fine. It's my pleasure because it's knowledge, awareness, increasing awareness is my passion because, you know, I've seen people struggle because they didn't know.
Lack of information, yes.
Yeah. Yeah. Even if my Bible tells us, you know, my people perish.
Yeah.
Right? We don't want to be that set of people. So we want to know. Okay. 1 more minute and we will start. Can you see my screen? I'm sharing my screen. No?
Not yet.
Okay. And if at any time anybody has a question, they can post it in the chat.
Sure. Yeah, I can see your screen now.
I'll ask after. So it's 11:10, and I think we can start.
Yeah.
Hello, hello, hello. I see more people connecting. Stephanie, welcome. So today is a special day because we're talking about a special group of people, women, women's health. So when we hear a woman, what comes to our mind? It is that feminine, soft-looking, but strong-willed person who is raising a family. I always say every woman is a mother. Whether you have your own children or whether you're you don't have a child of your own, every woman has that nurturing quality that makes her a woman. Woman is a helper to a man. We were created for a purpose, to help, to assist, to nurture. And we have to do that in good health. Thank you. Welcome, welcome. Chinwa, I see you. Welcome. Stephanie and many others. Thank you all for connecting. So we're talking about women's health today. How can we empower women to maintain their wellness and still do the function that they were created to do at every stage of their life? So first, a woman was born, right? This is Dr. Evangeline Obi first. I have to introduce myself with Ministry Wellness Center. Ministry Wellness Center is an organization that is here to increase awareness in health for everybody, women, men, children, so people are well equipped and encouraged to maintain their wellness, prevent diseases, and for those that have diseases, that they take good care of it. They know what their numbers mean and how to best manage that disease condition that has been appropriately diagnosed, so that they still maintain wellness and live a long, productive life. So today is a women's health, and a woman, we say it is a feminine figure that is well-powered and nurtures and raises a family. And every woman has the quality of a mother. Whether it's a child of your own or you don't have a child of your own, you have that quality to nurture. I've seen people who didn't have children of their own, but they raised great men and women, either through education, in teaching them in school, residency, in everywhere you meet somebody who can learn from you, you're open and willing to take somebody under your wings and teach them and watch them grow. You are still doing that function of a mother, a woman. And those people live long, they may remember you even more than they remember their own biological mother. So whenever we have opportunity to help someone grow, let us not misuse that opportunity. Let us take it as a function, a task that has been brought to us, and do it well. So we talk about women's health at every stage. So a woman maintains their health. So, and I'm privileged being a family physician. I see women at every stage. I take care of, taking care of newborns up to old age. And during that span, we see women, young, newborn, middle, teenagers, reproductive age, having children, menopausal with all the struggles of menopause, and then old age. So going on to the next slide, a woman, hey, it was just a Women's Month, International Women's Day. So I greet every woman here. So the goal of this presentation is that we know the qualities of a woman and how they impact the woman's health at different stages. So general qualities of a woman is that appearance of a woman. Woman is a feminine because of the hormones we have, and they are resilient. A woman can go out and come back with a man and still have the strength to continue the task in the house. Make sure everybody's taken care of, make sure the husband, the children, the family, whoever is with them are taken care of. That's the nurturing qualities of a woman, and that's why women are resilient. And then the hormonal factors that impact women. We go through changes, growing up, periods and all that, having to deal with it, mid-cycle pain of ovulation, then the period itself. And then every month we go through it again. It is not easy. And all those times, hormones are running havoc in our body. Sometimes periods are irregular. We have a lot of cramping. Then we go through period time, and then it's menopausal time, the hot flashes and everything that goes with it. It's all hormones, estrogen, progesterone, everything running. Each time, each period, one is high, the other is low, and things. It impacts us not just physically, emotionally. Sometimes you see that you're crying all the time, you're yelling all the time, you're reacting, making a mountain out of a molehill, somebody does something to you, instead of focusing on that, you're going through every different history you've gone, you can touch. It's all hormones, and it's okay. And some of our men understand that, and they learn to deal with it in a healthy way, but some can never understand it. And that's why we have different issues growing up, because of all these hormones running, through our body. So it's okay if we understand what the hormones does to us as a woman, then we can better deal with situations in our life. But let's take it to different stages. So as we are born, then we grow, children grow. So female, if you've noticed, if you have a boy and a girl same age, the female tend to grow quicker. So the growth spurt in young female is quicker. It comes more early. So a boy could be looking at a girl, same age that they've been playing with, same time, just mature quicker. The breasts start to show, the curves starts to show, estrogen start doing its physical things on the body and emotions. And, it's amazing. Young boys think it's amazing. They wonder, they look, and people look, start seeing all that curves, and that puts that woman at risk. Sometimes they can be abused because of that. Yes, they can be loved too, but different things can happen at that stage with that hormone initial changes. Then they start having the periods coming, being irregular, relationships and all that. So as they grow older, in their late teens and early adult life, then they start having different things. Hormones can lead to different health symptoms. So because estrogen is higher in that age, a woman can be having a heart attack and not even have the classic sign of, oh, my chest pain. No, it might not show as a classic chest pain. It might just show as fatigue, jaw pain. I don't feel like my usual self, malaise, and you're wondering what's going on. It could be a heart attack. So women, their symptoms are not classic, and sometimes it's because of the hormones, because estrogen is known to protect women from early heart attacks. So some people might mistake those symptoms for heart attack. So if your doctor knows you well and knows that you have a risk, cardiovascular risk, and maybe you're overweight, maybe your blood pressure is high and sugar high, if they put all those risk factors together, they may start to do workup for heart attack. But some can wave that fatigue off as, oh, you're doing too much rest, or jaw pain, or arm pain as, oh, it's not pain, maybe you overworked yourself, get some rest. But check the risk factors. Cardiovascular risks are always good to know and use to check and know when to be serious when a woman feels that way. Then the women have increased heart and cancer risk. With all the hormones going through our body, we're more to get ill and sick. And that's why the women tend to go to the doctor more than the men. It could be hormonal changes. It could be looking to get pregnant. It could be sugar high, and some women, as they're pregnant, they start showing gestational diabetes or hypertension, preeclampsia. All those, women start showing I'm sorry, something came up on my screen. So all these things put women at risk, and also the genital composition, the way our the anus is close to the vagina, puts women at risk for urinary tract infection more than men. When a man starts having urinary tract infection, it's a complicated UTI, but women is usually non-complicated because it's more likely to happen in women. So you see women having more of UTIs, having more of women's infections like bacterial vaginosis, like yeast infection, maybe after taking antibiotics, it clears the normal flora in the vagina and causes yeast to grow. So you see women having post-antibiotic candida infection in the vagina with itching and burning and pain. So women are put at risk in different ways. Also, sexually transmitted infection, the way women are made up, they are more at risk for that. Then the screening for cancer for women starts earlier than for men with cervical cancer screening, pap smear, at 21, because women are at more risk with human papillomavirus and other sexually transmitted infections like gonorrhea, chlamydia. If it's not noted on time, can cause infertility, can obstruct the fallopian tubes and cause infertility. So women, because of the nature of our body makeup with the hormones, we're more at risk to have infections and show abnormal signs, non-classic signs of symptoms of infections or disease conditions, and also risk for abuse at an early age because of that curvy nature and the way our body is built. And that's why women need to be protected from early age. Protect the women, be mindful who you expose your child to. You know, protect them, love them. The younger age, at younger age, women have more energy. Think about our young girls. They run, they jump, they hop, less stress. They're not worried about bills to pay or anything, and more love. Family loves them. They are the daddy's girl, mommy's girl. Everybody loves them. They are lovable. But we still have the bad ones that want to harm these children. So we still protect them. And this is how we should be. If we can maintain this kind of life through even our adult life, it helps us to be more focused and productive. But if any of these stages is tampered with by anything, it puts that woman, that female, at a risk. So if we stop being energetic, if we stop jumping, playing, being happy, if we stop being happy and not stressed, we carry on too many things and be weighed down with stress. And if we are seeking for love and there's love nowhere, or it appears like there's love nowhere for us, all those starts weighing down on the woman and causing a lot of things. It can cause the woman to start gaining weight. First, it throws off the hormones, the normal, natural hormonal system balance in the body. It throws it off. We can think of now an athletic, who is very successful. They start practicing so strongly, don't eat well. They are very anxious to be the best and do well. And that's, you can sometimes notice that their period cease. They stop getting their monthly periods. That's stress. It shuts down. It's like a shock to the hormonal system, and it throws off their hormones. Or on the other end, when people get depressed, stressed, and start eating too much, gaining weight, that can also make their periods irregular and also harm the body. You may hear PCOS. PCOS is polycystic ovarian syndrome, which occurs more in the reproductive age female and causes them to be non-reproductive at that stage because of hormone imbalance. There's overweight, there's male facial hair, there's irregular periods, and they may not be ovulating, though they are menstruating, they're having their period every month. And it's all stress, insulin resistance, and if their doctor catches it on time and puts them on put them on the right medication, it can help regulate their period, and they may start having normal period and maybe become reproductive again. So all these things has to be caught on time, because if any stage passes, it has passed. It can't go back. There's a reproductive age. If it's not caught on time and you try, don't get pregnant, it's late. If you have to get pregnant again, it may take more effort to do that. So that's why we start on time to identify these challenges for a young girl and address it on time. Make sure reproductive age women, especially in their 30s, are on folic acid. And now children, when they are born, they are started on vitamin D supplement, because many people are deficient. They are deficient not because they don't go out in the sun, they don't eat the right food, because almost everything is now fortified with vitamin D. They are low because their body is not absorbing it well. So they still need supplement. And that's why newborns, it's advisable to give 400 units of vitamin D one drop every day by mouth, to help them strengthen the bones, strengthen the body, help with metabolism, and help them grow. Then the middle-aged ones, reproductive age, that are having their periods, to and older in their 30s, to be on folic acid to protect the spine of the baby if they do get pregnant, and avoid like spina bifida. Because if that happens, that could be reason for early miscarriage, first trimester miscarriage that we don't really know. Most times it's genetic, and the baby is lost, or inability to even get pregnant. So make sure women are supported as they grow. So the early menstrual age, I just timed it 12 to 29 years old, thereabouts. Their physical appearance is important to them. Some people can even go into depression just if they don't look the way they should look. They don't have the breasts, the curvy figure. That physical appearance not being the way every woman's appearance should be can be depressing to some. And the family needs to identify that on time and help that female. There's a lot of hormonal turmoil going on in that period. They get their periods, which can be stressful for women. The polycystic ovarian syndrome I talked about. Some of them may need birth control, not just to prevent pregnancy. They may not be sexually active, but they may need birth control to help regulate their period, or to help reduce dysmenorrhea, pain with their periods. Because some female at that age, their periods are very painful. And I've seen some that miss work just because of painful periods, cramping. And birth control helps reduce all that and helps regulate their period, so they don't when you don't know when your period is coming, it can be embarrassing. You may go out at the start and you get stained, and it's very, nobody wants that. So birth control helps regulate it. At that stage, because of the curvy nature, sex, attraction, starts coming. Acne, facial acne can be due to hormonal imbalance at that stage. And then, of course, pregnancy can happen. So you start on time to educate this young female. And there's increased stress at this time because they are maturing, they don't know what is what. And I tell young adults or late teenagers, I tell them it's okay, because at a young age, the peer pressure, their friends could be more important than their parents. And when I get young female like that, I tell them, I know your friends are important to you, but you all are learning. You don't understand what's going on in your body, and your parents are your best advocates. Your parents, if you don't understand anything, make sure you talk to your mother or your father, whoever is your parent or guardian, whoever is there, has your best interest. So talk to them. A lot of children going to have a lot of peer pressure at that age because they're all maturing. They see things. They think, oh, this person has this, I don't have it. Why? But some start early. Just make sure you encourage them, you advise them. Some start early to mature, some later. Be patient. peer pressure, there's substance use at this time. Because of the emotional changes, they may try different things, and some can be very harmful. Some have gone, just mental, using or trying certain things. And also they try some things and they are exposed to sexually transmitted infections. So this is a very delicate age. We have to really talk to our young female, make sure they are seeing their doctor. And this is an age of emancipation. When a woman is young like this, I've seen 15-year-old, they're still a child, a minor. But if they want to talk things about women's health, about sexual things, yes, you can talk to them alone without their parents. So this is a very important age. They make decisions and you guide them. I always tell them about the safe, I tell them, avoiding sex is the best way to avoid all this hassle of getting pregnant, of not getting pregnant, not getting sexually transmitted infection, protecting your body. But if you must, because we know all the things happening in the world today, if you must, let us know. There are ways to protect from getting pregnant, ways to protect from getting sexually transmitted infection. Just let us know. Make sure you use condoms. There are birth controls to protect from pregnancy. Make sure they know, because there is a lot of young women there that don't know until they get in trouble and then start getting into other things. It's like a chain reaction. And their mental health, there's a lot of mental health challenges at this age because they're still young, they're still dependent, and the wrong people can take advantage of that and misabuse them. So make sure they have everything they need that is reasonable. First, you talk to them, they understand life is hard, and make reasonable demands, and you provide for them, protect them, and give them what they need. Those that is a time that we start talking about depression. If somebody has a young mothers at this time, they can go into postpartum depression, and we screen for that. So any woman that has had a child within a year of having a child, we still talk to them about postpartum depression because it's real. It could happen. Stress can lead to many things. Now, many jobs have a nursing mother's room, which is a quiet room where a mother is allowed to pump and take care, prepare things for their baby. Even the airports have them. So the other people are thinking about women, because women are special. We have things we need, and they are time sensitive and need to be provided to help women take care, not just for themselves, but for their children and others they are nurturing, even their husband. If a man takes good care of a woman, that woman will take good care of that man. It is women mostly that bring their husbands to my clinic to be seen, because men think, oh, I'm strong, I got this. But most times it's not about your strength. You need to be screened to know how strong you really are, how well you really are. So women do a great job and should be taken care of. I just saw a woman yesterday who, what's important to her in my clinic is having a hanger by the door for her purse and for her coat. She's like, Dr. Obi, I can't keep my purse and my coat on a chair. It's, and it's true. So we make accommodations for our women because women are special. And what we need, the world might not know it until we voice it out. So women, I admire you all for all you do. So then there's the late menstrual age. I call it the 30s to the 49. At this age, there are many health challenges by this time. If we did not do things right, by this time we might be struggling with fertility issues. We need to be on folic acid, I said earlier, at this age. We need to maintain our body vitamins, especially vitamin D. I've had a woman struggling with pregnancy, and what we did was to work on weight loss, put on vitamin D because it was very low. And shortly after, okay, I'm coming. Shortly after she got pregnant. So many little things, they're little, but they can impact the health of that woman and impact the whole family. So blood pressure starts about this time if they're eating poorly and stressed and poor, wrong weight. Blood sugar, diabetes is real. Is there any question at this time? I can take any question, then we can finish up. Any question so far? Remember to write in the chat group, okay? Any question or comments before I continue?
Yes, Evangel.
Okay,
Good
go ahead.
morning.
Good morning.
Good morning. It's a pleasure to be here. Thank you for
Thank
inviting me.
you. Okay.
You look amazing and you're doing amazing.
Thank
well.
you. Thank you.
Yeah,
too.
thank you. By the way, how is our little baby? You're such an
great.
incredible mother.
Thank you. Thank you. He's here giving me some trouble, but he's good.
Amazing. So when you talked about girls being the adolescents and sex, because of the curvy nature of the vagina, the vaginal canal. Did you get that? The curvy nature, the curvy nature
yeah.
of their vaginal canal.
Curvy nature of their body, of the
their body. And
yes, the physique.
Okay, for enjoying sex. Is that what you said? I wanted to clarify.
No, the curvy nature puts them at risk for men, men will admire them and puts them at risk for relationships and sex and all that. So because people like to see good things, men go by their vision, what they see. So when they see good girl, they want relationship, and some that are not well advised or strong can be praised for those men. And that exposes them to sex. Yeah.
Okay. All right. That I understand. I was thinking that you are saying that because of the way the vagina is positioned and, it's not like a straight path, that it makes them enjoy sex more. That was what I thought it meant. Thank you. And good morning to all the ladies in the house. God bless you all for showing up.
All right. Thank you so much, Ewan.
You're welcome.
So there are different conditions the woman are exposed to in this age. That we talked about blood pressure, blood sugar, cholesterol can be high if they're eating poorly. Their body mass index, by this time, hormone changes and lifestyle, they start getting overweight. Then the waist circumference is enlarged. It should be less than 35 inches for female to maintain health, but this time it's big, it could be bigger. So this puts them at risk. So need to be watched. So when a woman sees a doctor, these are some of the tests that is expected. The fasting lipid profile to check for cholesterol, hemoglobin A1C for diabetes or glucose intolerance, thyroid function test for the thyroid, because if the thyroid is low or high, it can cause depression, can be reason for depression, weight gain, all that, because thyroid helps with metabolism. So when the thyroid hormones are low, those women, they eat, gain weight, they lose hair, no motivation, depression, So need to know, because this could be reason for all the struggles. Or if it is high, the thyroid hormone is high, it's like metabolism is going too fast. They could be having diarrhea, they're unable to gain weight, they're, skinny and going too fast, heart rate is fast, and that puts them at risk for cardiovascular diseases. Then the CBC, anemia. Anemia is very common in many female. Sometimes your doctor could check your blood count and it's normal. It could be normal looking. Hemoglobin might look normal just because you're not well hydrated. Because if you're well hydrated, then you see the true low hemoglobin. If you're not well hydrated, it may look like it's normal because of hemo concentration, and your iron might be low because as we bleed every month, we're losing iron. And for some, it's heavy, while others is normal or moderate. So if you're having heavy periods and always fatigued, make sure, even if your CBC, your hemoglobin is normal, that your doctor checks your iron level. Yeah, doctor checks your iron level. Make sure iron is not low, because iron is low, it makes it hard. You're always tired because iron is needed for blood cell production. So iron studies. Then the chemistry, you check kidney, liver function, and electrolytes. Make sure all those are okay. Interleukin-6 and CRP, these are not commonly done, but these are stress factors that could be high when people are so stressed. I did a research where this was what we used to monitor people who are stressed. And at the beginning, before we started that program, the research, this was high in some, but as we talked about wellness and did the right things, it came down with eating healthy, staying active, relaxing, sleeping well. So these are stress factors that can be checked. Vitamin D, of course, then B12 and folate, very important. Prolactin, very important in women, because if this is high, it's made in the brain, pituitary gland. It could signify early ovarian failure. That's though you're menstruating, you might not be ovulating, and your doctor you might need to be on medication to help improve fertility. Cortisol and insulin are also other hormones that can be checked, stress related. And other things could be pure hormones, the progesterone, estrogen, FHLS, LH, FSH, LH are other hormones that can be checked. These are mostly if you're monitoring a woman, are they menopausal or not, what's going on. You can go into those. Then cancer scare is also at that age, because at 21 age, we start screening for cervical cancer, and you may see abnormal cells or abnormal positive HPV, and you need to address it. And these are all stressful for these women. Mammogram, mostly we start at 40 unless if there's reason to start early. Colonoscopy starts at 45. So that age group is where we start all this cancer screening, and that could be stressful for people as you wait for results, as you see a little abnormality that needs to be followed up on. Other cancer screenings, besides the cervical and breast and age-related, when you screen them, are here, listed here. Cervical is 21 years old, we start till 65, we stop. Breast cancer is 40 to 75-year-old. Prostate for men is 40 to 75. And colon cancer screening now is 45 to 75. It used to be 50. Lung cancer, mostly for those who smoked. Everyone who had a smoking history, I think that is 55 years old. I think they've reduced this to 50 years old. And that smoked significantly, 30-pack year history, or quit less than 15 years ago. You screen them with a low-dose CT scan for lung cancer. So menopausal age, this is the exciting age. So you're now a menopausal female, you have things you go through. So at every stage of a woman's life, there's something they are going through. Are they growing up? Are they there reproductive? Are they non-reproductive again? Before you get to quite menopausal, you start having what we call perimenopausal stage. You start, estrogen starts declining, you start gaining weight, you start having hot flashes, vaginal dryness, which can impact relationship. And we have to be careful because women, we don't like to talk about these things, but it's real, it happens. Bone becomes weak because estrogen helps strengthen our bones. So when estrogen starts declining, bone starts getting weak. That's why you need to be sure your vitamin D is within normal range. And I hear some people say, oh, my vitamin D was corrected and therefore I'm no longer taking it. No, you must always be on vitamin D. Again, once it's low, it's because your body is not absorbing it. So you need to be on supplements. Even when your doctor uses a big 50,000 units dose to correct it and bring it to normal of 30 to 100 range, you need to be on daily vitamin D supplement to maintain it at normal. Because if you stop completely, it will drop down again, if not even lower. So make sure your vitamin D is normal with calcium to strengthen your bone and avoid falls, because as we get older, things shift, balance is not as it used to be, weight is there, and some pain from arthritis. We're more at risk for fall. And so we should protect ourselves from fall, our older people from, they say from 65 and above, but I would say from 50 and above, because, you know, just like now, diabetes can be at a younger age. Old age things can start happening at a younger age. So if you're 50, overweight, and you see that you're arthritic, you have arthritis, your balance is not good, make sure you protect yourself. If you have to walk with a cane for support, do that, because you don't want to fall. Because women are more likely to fracture at older age from a fall. So at this time, you need to be exercising. Exercise also strengthens the bone. Aerobic exercises, movement, keep moving to keep that bones and muscles strong and good to protect your joints. I hate to see older people who they've done everything they should do, then they fall and fracture something. Sometimes they never recover from that fracture, hip fracture, some bone fracture that keeps them in wheelchair, and from there is a downhill till they pass. So make sure you avoid falls at every cost. Post-menopausal, after you've been menopausal and everything is gone, you're now really no more periods, because perimenopausal, I told you, is that before you get to full menopause. So full menopause is when you've not had a period for 12 months, for a full year or longer, you're menopausal. But some women can skip periods for 2 months, 3 months, 4 months, 6 months, and then have one. You're still perimenopausal. Until you don't have a period for a full 1 year and onwards, then you're menopausal. And by this time, you're really grayed out. You know you're old, maybe grandmother by God's grace. This woman looks like one of us here. But you may have grandchildren, you're playing with them, you're relaxed, more relaxed. You may have retired, not running to work back and forth. You may, if you're postmenopausal for real and you have a bleeding, vaginal bleeding, make sure you talk to a doctor. I've seen people come to me and I'm taking history, and they're like, yeah, I've been menopausal, but last month I had a period. I'm like, what did you do? Nothing. That could be a red flag for endometrial cancer. So postmenopausal bleed is very vital. So talk to your doctor if you've been fully menopausal and you have a vaginal bleeding. So they work it up and make sure, do endometrial biopsy, curettage, and make sure no endometrial cancer. Again, this age are at risk for fall and fracture because of thin bone osteoporosis. So if your doctor does the FRAX risk score and it's significant, you may need to do a DEXA scan to see how strong your bone density is, and see if you need to be on medication besides vitamin D. Sometimes they put them on bisphosphonates to strengthen the bones. So these you need to follow up on. So there's a lot to talk about on women. We are special. One thing I want to go back to is the vaginal dryness. If you're menopausal and having those symptoms, hot flashes, you have to put the window open, put on AC even in the middle of winter, and it's a struggle with you and your husband. Make sure your husband understands. Work it out. Vaginal dryness, you don't want to have sex, you're running away. There are things to help women because you have to maintain your relationship. You have to maintain your relationship. Talk to your doctor. Don't be shy. There are medications, herbal medications. There's over-the-counter medications. Primrose oil has helped some. Black cohosh. These are some of the over-the-counter things some women have used and say they help. If you've done the natural things, wearing light clothing, cooling your environment, and it doesn't work, those things could help you. Also, there are medications, prescription medications that can help. Some SSRI, SNRIs, your doctor can prescribe to help you. Venlafaxine for one is one I've seen. Patients say it helped them. And then there's a hormone. When you've done everything and those don't help you, then hormones, a little bit of estrogen can help. The risk is maybe endometrial cancer, but for women who have had hysterectomy, no endometrium, no uterus, yeah, they are less at risk. Topical estrogen can help relieve that symptoms. Using lubricants to keep the vagina moist can help, but hormones can help a little bit. But you work with your doctor to help you. So at least you're happy within yourself, and also your partner is happy, because vaginal dryness, when it's dry, it can be irritating, uncomfortable. It can put you at risk for infection, because dryness, just like on the skin, dry skin puts you at risk for eczema. Vaginally, dry skin puts you at risk for some infection, yeast infection also. So make sure you address these things when they happen, depending on the stage of your life, with your doctor. So this is just a little bit on women's health. We can do this more if you guys want it, and I want it to be more interactive because I know many of us have a lot to say on women's health based on the experience. So some few take-home points today are: we are unique. We're beautifully and wonderfully made. Every woman, admire your body, no matter what you look like, and admire others when you see it, because in life, this is not just about health, though I always put that health. We cannot separate emotions and spirituality from our health. When we're not healthy or clean thinking in our hearts, it can impact our health directly or indirectly. So when we see good things, let's acknowledge it. Let's be open. Let's be free. And let's be sincere. Let's admire what we have. And if we need help, ask for help. Get what we want to make us live a good, healthy, happy life. Start early to protect yourself by getting annual screenings. You can't tell who is well or who is not by just looking at them. It's by screenings. Follow with your doctor. Have a good doctor you trust. Work with your doctor to get screened at the right time. Be aware of how your body changes due to the hormones. When you start feeling a kind of a way, crying a lot, being snappy, angry, and hot flashes, uncomfortable, know what's going on and know when to talk to your doctor or ask for help. And one thing I want to make sure women understand, I know we say we nurture and take care of the family. Know when to take a break. Know when to take a break. Okay, honey, I'm tired tonight. Can you help me with this? Can you do this? Or your children, if if they are there and supportive, oh, baby, can you do this? Can you wash this? Know when to ask for help, because I know we always want to do everything and we give and give and give until we have nothing else to give. Sometimes we need to be selfish. Take care of yourself, pamper yourself, go out, have a good time. Don't be apologetic about it. Take care of yourself so you equip yourself, be strong to take care of others, your family, and even the community. Do what you have to do, but take care of yourself. Empower empowerment through education, learn, and self-care and well-being for women. So make sure you're doing things for yourself. Taking care of yourself is not a crime, and help your family. Nurture them. That husband of yours, be there for him. If he's the king, then you're the queen. Your children, if you raise them well, especially God-fearing, because that's the first thing before everything else, because there's a lot in this world today. So that if they know God and you trust that they will do well when they're out there in the society, then you're more at peace. Your heart is more at rest. But if we're not sure what they're doing, it's a heartache. It can kill us just worrying and thinking. So women, let's do the work we're created to be. Nurture, nurture, nurture whoever God brings our way. Let us do that work. Thank you all. That brings us to the end. Any question, any comment? And are there any chats? Let me see. Go ahead. If you want to talk, you can unmute and talk.
Thank you, Dr. Obi.
Thank you.
This is Miss Princess.
Thank you.
Princess, thank you. Thank you.
This webinar has been such an eye-opener.
Thank
You
you.
covered from birth to old age. So that's wonderful.
Thank you.
I have a question with vitamin D.
Correct. Go ahead.
Once they're off the 50 units, what is the daily maintenance number?
Okay. So the 50,000 international units is usually the big dose doctors give weekly. You take it once a week. Usually for my patients, by the second or third month, it should be within the normal range. Some people, it's within the 2 months or before the 2 months, it's like close to the upper limit of normal in the 80s or 90s. So I usually check it by the second to third month of putting them on that weekly one. And if it's within the normal range of 30 to 100, I then put them on daily, maybe 1,000 units, depending on what it was when we started and what the last number I got was. So usually 1,000 to 2,000 units daily, and maybe check it again another 2 months later. If it's still staying within the normal range, then that's good for them. I like to see it around 50 to 60. And that's where most endocrinologists want it. That way, even if you don't go out in the sun a lot, maybe it's winter and it drops, it doesn't go below 30.
Okay.
And we check.
What if you take the 50 and it doesn't go up? What's going on?
Good question. Very good question. So what I've seen happen is, vitamin D and magnesium are both absorbed together. They'll go hand in hand. So I've seen patients that are deficient in magnesium and vitamin D. And if you're replacing just vitamin D, it's hard to get them high. So make sure you take magnesium and sometimes supplement vitamin D with magnesium. And that way it usually goes up.
Awesome.
I've also seen some that are on twice weekly. So we do once a week for majority of the people, but some people need it more, especially those that are single digits. Maybe when you check it, it was like a 6. I could do maybe the first month, take it twice a week. And then by the second month, usually it's up to normal.
Yeah, I have a family member that has it at 25 and they're on the 50 units. And it seems not to be going up.
Almost done, baby. Almost done. Yeah, okay. So make sure you can double what they're taking, or you can, it's not here, or you can check magnesium and give them with magnesium.
Okay.
Maybe magnesium oxide, 400 milligram once or twice a day, and then check magnesium. Magnesium, check the level in a month or 2. Magnesium is important for sleep. When people tell me they have difficulty sleeping, I check serum magnesium level.
Okay, so what's the number for magnesium?
You mean the lab number or the amount?
The lab number and the amount they should
Yeah,
take.
I give magnesium oxide 400 milligram once or
Okay.
twice a day, depending on how low. Most labs have different range for
Markers.
magnesium, but I think it's like 1.8 to like 3 points.
Okay.
But it depends on the lab that did the test. They will tell you what
Right.
the range is.
Okay.
Yeah.
So make sure they check their magnesium and vitamin D levels.
Correct. And supplement both. Usually you get it up, the vitamin D, or you double the dose of vitamin D.
Okay. I don't want to take most of your time, but you said something
Okay.
about bone. Can you elaborate on that after the DEXA test and everything? Where is it
So
supposed to be?
yeah, the DEXA scan is a bone density scan that is done. Usually thin white women are the ones that are mostly at risk, study shows, but it can be a big black woman who not eating well, not moving much, and the bones are weak. So if somebody is at risk, maybe they've had a fracture once or family history of fracture, or they're on chronic steroid use, prednisone, people who have maybe lupus on prednisone, it weakens the bones, or even they smoking weakens the bones. So those risks, you can add it up. There's a FRAX score that is used. Check that, then you can do the DEXA scan. Send them to the radiology refer them to do the DEXA scan. If it's minus 2.0 or below, then that's like osteopenia. The bone is weak, but not quite osteoporosis. But if it's minus 2.5, that's definition of osteoporosis. And they have to be on bisphosphonate, like Fosamax. They have to be on bisphosphonate to help strengthen the bone, and you recheck in a year or two. Bisphosphonate, they stay on it for like 5 years, then they take a break because it can make the bones too thick and then put them at risk for fracture, unusual bone fracture, the femur mostly. So DEXA scan, anybody you see that is at risk for a fracture, do the DEXA scan. Depending on where the number is, the T-score is, then you can put them on either make sure vitamin D and calcium is good number. I have a patient who couldn't tolerate bisphosphonate. So main thing is monitoring her vitamin D and make sure she's on good dose and stays above 50 for her number. So you check that, but if it's minus 2.5 DEXA score or higher, then you put them on bisphosphonate and repeat in 2 years or so to see if its bone is strengthening or if it's getting worse.
Okay. What is the alendronate for?
Yeah, that's the Fosamax. That's the bisphosphonate, yeah. And make sure they are taking it the right way, because they may not be taking it the right way. You're supposed to sit up, take it once a week, 75 milligram, and no food for 30 minutes after taking it, so your body can absorb it well. If you're not taking it well, that could be the reason that is not supporting the bone as expected.
Okay, so sit up and take it. I know it's written on there.
Yeah.
Sit up and take it and no food for 30 minutes.
Correct, after using it. You don't eat before and after for 30 minutes, yeah.
Thank you so much. I really appreciate
Not
you.
a problem.
And I thank everybody for accommodating my questions.
I'm sure they're okay. Any other question, comment? Do you want us to do this again? Or do you have any other topic?
Yes,
Who
please.
said, yeah, any other
Chinwe.
topic? Okay, Chinwe, okay.
This is Stephanie. I have to leave, but this is so refreshing.
Thank you, Stephanie.
I'm not telling my age, but I'm also looking for some healthcare initiatives for 50 and older. Specifically,
we now have a clue.
I know. I do have some topics of interest that I've been researching myself, things like bone density,
Okay.
You know, what happens after menopause. I do want to circle back on vitamin D, how much is too much, too less, and outcomes and shortfalls and pitfalls. So some of those things I will send to you in case you have that on your agenda. But this is so refreshing. This was excellent. Sorry I got run, but I got to hit another meeting.
Okay, thanks,
All right.
Stephanie, for
Thank
joining.
you.
And good
Okay.
you mentioned what is too much, because vitamin D, we check level. It's important to know because it can be toxic. It's
Right.
fat soluble, so if you take too much, it can deposit in tissues and cause more harm. So you have to make sure you check the level, and if it's low, you take the right dose and your doctor check again. And if you're on the maintenance dose for 3 months or more and check and it's still within range, then that's the range that is good for you. That's the amount that is good for you.
Okay, and doing it by blood test is the correct way, right?
Yeah.
Okay.
You can't tell anyway, but unless
Right.
you do the blood test for vitamin D. Yeah.
Okay, awesome. Thank you so much. See you ladies.
See
Bye-bye.
you, Stephanie.
All
Bye-bye.
right. Have a good day.
You too. Bye-bye.
Okay, guys, if there's no other question or comment, I guess we come to the end of the presentation. Thank you all so much for connecting. I know some connected from out of states and some within states. So I appreciate you all for your time. Love you all. Take
Love
care.
you too. Thank you so much. Are you going to send out this
The
session?
slide. Yeah, the recording will be shared.
Okay.
I don't know if the support team is here, but she can share to everyone who signed up.
That would be great.
Has
Thank
their
you
email.
so much.
Not a
You
problem.
are awesome. Thank you.
Thank you. And if anybody have a topic or something they are passionate about and want to share with us, because we're here to grow and learn and grow, let us know. Yeah. The support team say they will share it.
I'm available, Evan.
Okay,
I'm
we'll
ready
talk
to
later.
share.
Shiva. We'll
Okay,
talk
we'll
later.
speak. I'll call
Love
you
to
later.
hear from you. Okay.
We'll
Take
speak
care,
in the
everyone.
evening.
Thank you. Have a good
lovely
rest
day.
of the week.
Thank you so
You
much.
too.
Bye, everyone.
Bye-bye.
Bye.
Bye.